Okay, now we're going to hear from Leslie Curtis, the Midwest Director of the National Nurses United.
Thank you. My name is Leslie Curtis, and I work for National Nurses United. We are the largest nursing union in the country, and I dare say the most progressive. So it's good to be in a room full of progressives. And we are rolling out a new campaign, so it's really a good time for you to invite me, as well as we had a huge rally in D.C. this weekend, which Tim was an invited speaker, Tim Carpenter, where the nurses are gravely concerned about the condition of our country as well as conditions of Americans. We're concerned about the Democratic Party and how some of our moderate Democrats actually help move the public option off the table. They have been unwilling to talk to us about universal health care. But if you know these group of women, no matter. They move forward with what they think is right for this society at this time. So what I got in front of you right now is our packet on the Main Street contract for the American people. And if you open that up, you'll see about our rally on the 7th of June, where we did lobby the senators. But I did want to talk a little bit about where it hurts. So we're out, if you go to our website at National Nurses United or protestinamerica.org, we have a couple. We're taking stories from people. Tell us where it hurts. Tell us what's going on. We hear every day about nurses, veterans. We represent veteran nurses. Here in Chicago, we represent the veteran nurses, we represent the Cook County nurses, we represent University of Chicago nurses, and we're on the way to represent the University of Illinois nurses. All of these nursing groups come to CNA or NNU for one reason, because they want to have a voice in their workplace, but they also want to advocate for our patients, because many times our patients are so sick they can't really advocate for ourselves. We have veterans who their costs have gone up so much on their prescriptive drugs that they've elected not to get their prescriptive drugs. These are folks who've come home from the war. We know, the war has been an economic drain on our society, but this crisis has really hit home, and we believe telling your story, or folks telling their story, is going to be key to help us move this campaign. Some of our fellow Americans have worked their whole lifetime to only find out now that there is a movement afoot to take whatever they have worked for away from them. That, Social Security, old folks, the retired, they used to be the Holy Grail. And like you, I spent some time with the steelworkers. So I know what steelworkers have gone through. Actually, Roseanne lent me to the steelworkers for a 4-year period to work with them on their health care and their universal health care program. So we know what these workers have gone through. I mean, pensions gone. And no excuse for pensions being gone. They blame workers for everything from giddy up to whoa, like my grandpa used to say. They blame us for everything. The pensions are bad, the workers are the blame. No one says, oh yeah, the workers make their contributions. Many times workers make their contributions into their pensions, but it's the politicians who've chosen, instead of investing that pension, we have Blagojevich take pension contributions to balance the budget, take pension contributions to do all sort of other things besides deposit them into our pension. So it's no wonder now that our pensions are underfunded, and they want to come after us now to refund them. We fought that fight in Springfield. We won it this year, but believe me, they're going to come back after public sector pensions once again. In addition to that, we have a piece of legislation in there, a piece of form for legislators. Which side are you on? I have to be honest with you. Our organization, sometimes we look at our Democrats, and we have traditionally supported Democrats, getting away from the principles of the labor union. Sam Gompers used to say we should reward our friends and punish our enemies. We should not have an alliance to any party, but we should work with those that work with us. And at one time, the party was that party. We've got to get that party back on the same page with us. People need to get on the right side of the issue. So we are asking both Democrats and Republicans, are you on the side of Wall Street? Do you believe that tax cuts for the rich and powerful? Do you believe that replacing Medicare's with vouchers, is that something you support? Do you believe cutting Social Security, shipping more jobs overseas, weakening our environmental laws as well as our regulations, privatizing education, destroying our unions? If you participate in that, whether you're Democrat or Republicans, you're not a friend of the nurses. That's our message to these elected folks. But if you want to be on the side of Main Street, the side that we all live on, because we live on the street, hopefully we still want to live on the sunny side of the street. And in order for us to do that, we need to have our politicians understand what is the legislation that people want. And I know that Americans have sent a strong message about Medicare and Medicaid. That the polls out there are 80% don't mess with it. But you know, the Republicans and some other folks are so bullheaded about getting control of that trust and getting control of that money, again, being on Wall Street side, that they're looking to obliterate it. If Medicare and Medicaid gets obliterated, if it goes into a voucher system, I submit to you that so many people will die. The number one reason for bankruptcy in this country is because people are either uninsured or underinsured. So you can still file bankruptcy and have one of these insurance plans. Meet your million dollar cap, which $1 million sounds like a lot of money. It used to be a lot of money, but now it's nothing. And you get a serious health care situation, you're bankrupt before you know it. It's the number one reason for bankruptcies in this country. So again, that's why our solution is universal health care, guaranteed health care for all. Now, we applaud some portions of the health care bill that came across, because there were things in the bill that were very good, but it left a lot of money on the table and actually put more money in the hands of the insurers and the providers. And they use that money for big trips, fancy offices, all kind of things that doesn't put that money at the bedside with you to get the care that you need. So Bernie Sanders has a bill. It has taken up the place of Conyers' bill, and it's H.R. 1200. Bernie Sanders' bill is Senate Bill 915. It is a universal health care bill. So this is legislation that the nurses are supporting. We're going out and we're talking to our congressional delegations here in Illinois, whether they are Democrats or Republicans. I have to say this is a nonpartisan campaign, and that we are going to put, pressure on our Democrats because they live in our district. But we did actually go see Mark Kirk and talk to him, and it took a lot for me to get an appointment with dude. It was tough. We also are saying a secure retirement for the ability to retire in dignity, no cuts in Social Security, Medicare, and Medicaid, okay? A fair taxation system, as well as restoring the promise of life, liberty, and the pursuit of happiness. So how are we going to do that? We'll be introducing in the next week some new legislation. It doesn't have a number right now because we want to put the right people on it, but it is called the Financial Transaction Tax. And this tax will be geared strictly at Wall Street. We believe this tax can bring in at least $300 to $400 billion a year to help us with this, because they're making all the money. They can tax us till the cows come home. We don't have enough money. That has been our economic situation here in this country. We need to stop it. The nurses have a plan. When we get to the question, I'll be happy to go over that with you. But we also have a way for you, if you want to volunteer with us. And also we're asking formal endorsement from the PDA to endorse our program. Nurses are spreading out across the country, talking to community organizations. There's a sheet in here if you have another organization you belong to that you would think would endorse our activity. And there's a lot of people out there doing a lot of things. This is what the nurses are doing. They're very serious about it. And in fact, on the 22nd of June, there will be a rally in Washington, in New York, in front of Federal Hall at noon, at Wall Street. Basically, taking it to them before the Europe Council meeting, which is on 23rd and 24th. They meet to talk about this very same thing, a fair tax system. We're not alone. This is a global market. It's a global squeeze. It's happening to everyone who lives and breathes on this earth. Thank you.
Thank you, Leslie.